Good morning, and sadly, welcome to the last day of our 19th Annual Leadership Summit. My name is Gary Puckrein, and I'm the president of the National Minority Equality Forum. On behalf of the National Minority Equality Forum and Congresswoman Kelly and the Congressional Black Caucus Health Braintrust, I welcome you. I want to do two quick things this morning and to help you understand and be centered around the work that the National Minority Equality Forum is doing. We've been looking at and working at issues around health disparities and inequalities now for almost 20 years. And I think the most important lesson that we've learned, and one I ask you to think about as you go back home, is really managing patient risk. Our sense is that any patient who comes in to the American healthcare system, the expectation is that the system is going to manage their risk. It's going to lower their risk for hospitalizations, for emergency room visits, for disability, for mortality, while improving the quality of their life. We think that formula, simple as it sounds, addresses the issue of health disparities and inequalities and makes sure that every person who comes into the healthcare system gets the treatment that they expect. No patient comes into the American healthcare system with the expectation that the system is going to elevate their risk, that the system is going to produce disparities. We think that's the formula that if we pay attention to, it's quantifiable. It's a way to keep the system honest. So we're going to be talking a lot about that over the coming days and months. We invite your comment and your participation. The other thing I want to do this morning, I want to thank all of the community organizations that we work with. Over the last 20 years, when we got started, we focused a lot on measuring health disparities. And what we realized is that we needed to get into community, we needed to partner. And we've been excited by all of the partnerships that we have developed at the community level. We share with them and they educate us. It is a powerful interaction. And as everyone knows, the National Minority Equality Forum, what we focused on is collecting health data. And we are taking that data and we are repurposing and collaborating with all of these community partners. And this work could not be done without the great staff that we have at the National Minority Equality Forum. So I didn't want this summit to end without saying a deep, heartfelt thank you to all of the organizations that we've collaborated with to address the issue of inequalities in healthcare. This morning, I have the great pleasure to introduce to you Leon McDougal, who is president of the National Medical Association. The National Medical Association has been a long-standing partner of NMQF. We've enjoyed the relationship. And so I present to you the president of NMA, Dr. McDougal.
Thank you so much, President Puckrein. And I just want to congratulate the National Medical Quality Forum for your outstanding leadership. And it seems as though every meeting I'm speaking at now, I'm acknowledging the Congressional Black Caucus Braintrust and Congresswoman Robin Kelly. I acknowledged her, I think, yesterday during a meeting, and just want to reflect on this past year. This past year has served as a stress test for communities where Black, Indigenous, and people of color live. And we need to extend this outcomes research, our advancing knowledge and improving the way that our community is treated, from the telephone call to make an appointment, to the front registration desk, to the medical assistants checking that person in. If it's research, the same, being the research nurses and the research team. We all need to advance and put forth promising practices to ensure that our community gets the best of health care. And it's such a honor to partner with President Puckrein in helping to make sure this happens. And I know this has been a wonderful conference, and I know today will be the same. So the National Medical Association in its 125th year joins you in this great work. Thank you, and have a wonderful summit.
Thank you so much, Dr. McDougall. So again, I want to thank all of the attendees for joining with us. The work is just beginning. When we finish today, we will begin to, I think, launch a series of initiatives that we'll be talking about later on today, with the real focus on reducing risk. We want to make sure that certainly when African Americans and Latinx and Native Americans and people of different creeds and sexual orientations, when they come into the system, that the system is really working for them. And so we look forward to your partnerships and your collaboration. And so I turn over the rest of the day to you and look forward to our ongoing conversations.